Biggest mistake in a century. Talk us through it, Jay.
So the logic is really simple. The harms from the lockdown include absolutely devastating physical and psychological harms that affect basically every poor person on the face of the earth. The UN estimates that over 100 million people will starve this year as a consequence of the lockdown, 80 million children thrown into poverty worldwide. Domestically in the United States, people have skipped cancer treatment. There will be women with stage 4 breast cancer that should have been caught last year. The lockdowns in the United States, anyways, have involved school closures on a massive scale. Australia, of course, has escaped a lot of this, in part because you all have closed your island off, in New Zealand even more, and in many ways you were fortunate, because what happened was that you closed the island off when there were very few cases, and the short lockdown could have worked. In the United States, in March, it was already too late. I think at a real level, the lockdowns as a long-term policy, even for Australia, are going to be difficult. It's going to take a while before all Australians are vaccinated. I noticed the plans to open the island it's going to take at least a year, where you're going to be isolated from much of the rest of the world. People can't come visit, and it'll be difficult to come back in and out. I think in some sense Australia has fared well, but still have faced enormous lockdown costs with the periodic, the uncertainty about if there's a single case, you have to shut down your entire regions. But for much of the rest of the world, Europe and the Americas, the lockdowns have not stopped the spread of the disease and have wreaked enormous harm on public health.
Rita.
You mentioned about cancer screenings being skipped. I'm wondering, what's the impact going to be on those serious issues? Heart disease, cancer. Around 10 million people die of cancer every single year around the world. Are we going to see a surge in those deaths of people dying in their 40s and 50s needlessly because they didn't catch it early?
Yeah, I'm quite worried about that, and I saw some reports that suggest exactly that's going to happen. There's preventable cancers preventable in the sense of you catch them early, you can treat them, and you get a good outcome. Breast cancer being prime among them, but also colon cancer. A lot of those skipped screenings are going to have their costs in this year and next year. There's, you mentioned heart disease, diabetes management. A lot of that also went by the wayside. We kept hospitals closed for the most part for much of the year, empty of patients we should have been treating, is waiting for COVID patients that didn't come. During the high season, of course, COVID was a big deal. But during much of the summer, we kept hospitals closed, and people were more scared of COVID than cancer when they should have been getting treated.
James.
Doctor, I note that the states in the United States that have locked down the hardest, including California, where you are right now, have had some of the worst results, whereas states that have been more open, such as Florida, have done relatively better. What did you make, Dr. Bhattacharya, of Joe Biden's comments earlier this week that, well, maybe if we're all very good, you just might be able to have a small gathering in your backyard, a couple of people for a hot dog for July 4th, when there are states that are getting out of lockdown, doing well, doing better, particularly with the vaccine? What did you think of the president's comments?
It's nonsense. Disney World has been open since July of last year. Disneyland is still closed. And yet California, where Disneyland is, has done worse in terms of age-adjusted mortality from COVID than Florida, where Disney World is. The lockdowns, we think of them as protecting the vulnerable, but they actually don't work to protect the vulnerable. In a way, it's like a failure of imagination. A lot of the public health community thought that we could use the lockdowns to protect the old, the vulnerable, but when they should have instead been doing is thinking of focused protection ideas to actually protect the vulnerable while letting the rest of the society avoid the psychological and physical harms of the lockdown. Lockdowns they provide an illusion of control. It was just a mistake. Florida has done vastly better than California. My kids are still not in school.
Jay, tell us also your thoughts on vaccines. Our Prime Minister is just about to have his second vaccine. What's the take from the Great Barrington Declaration? So we've got him live now, just about to be have his needle stuck in there, Jay. But talk to us your thoughts on the vaccines and your take on them.
I actually think they're one of the few good things that have come out of this epidemic. The science of the vaccines is incredible. I mean, it's just beautiful science. And they are a great tool for focus protection. And I noticed that Australia has adopted the Great Barrington Declaration. By prioritizing older people for the vaccine first, you're doing a form of focus protection, which is, I think, a very, very good thing. I think in fact, a lot of countries have adopted exactly the Great Barrington Plan now that a vaccine is here. The issue is, why didn't we adopt other strategies to protect the vulnerable earlier? I do think that there are some concerns about the vaccines. For instance, it's not been tested yet in children. I wouldn't recommend it to get in children yet. I am not convinced by the safety in pregnant women as yet. I mean, there's still, I'd say I would need more data to be convinced on that. But for older populations, and for people, late middle ages, this is a no-brainer. It's a good vaccine, and it is. I'm going to get it as soon as it's my turn. It was a big relief to me when my mom, 80 years old, finally got it.
So, Rita,
I want to ask you about the merits of locking down healthy people as opposed to protecting the vulnerable population. And we've adopted the lockdown strategy here in Victoria, where I am. We had a 112-day lockdown at one stage, and we've applauded ourselves about, well, that solved our issue. But how do you see that approach? As an expert in the field, how do you see Australia's long-term approach? Whilst the rest of the world seems to have learned to live with this virus, are we in a worse position going forward because we're going to be more hesitant to open up our borders? I'm just interested in your take from someone who's in the US about when Australia will feel safe to join the rest of the world.
I think Australia will not open until the vast majority of the population is vaccinated. Unfortunately, I think, and that will be I'm not privy to the logistics of it, but I would imagine it's going to take quite some time. The issue is this: even after you focus protection of the vulnerable in Australia with the vaccine, as soon as you open up, you're going to get cases. And if the political response is to shut down Victoria for 3 months on the basis of a few cases, you can just imagine the panic, just cases that aren't actually likely to produce death is going to cause. Australia is going to be isolated from the world in a way it has not been for a good long time, I think, unfortunately, as a result of this. The policy that Australia followed, it's created this sort of deep uncertainty. Your normal life could be upended at any moment. The psychological stress from that, I think, is going to be great. Is already great, I think. In the U.S., the psychological stress from the lockdowns have led to 1 in 4 young adults seriously considering suicide, according to a CDC survey this past June. I think that it's not sustainable. I think that the right approach is a focused protection approach that avoids the lockdown and all the harms that come with it.
James.
So would you say then that the public health lobby has had a big fail here because they failed to educate people that if you are not over, say, 65 is an arbitrary cutoff age, if you catch coronavirus, you are almost surely going to be fine?
Yeah, I think is an enormous failure on a couple of levels. One is that we induce panic in the population that it's just never a good public health strategy. The data show that the survival rate, if you're over 70, is 95%, and the survival rate if you're under 70 is 99.95%. 99.95%. If you're a child, actually the flu is worse, much worse in many countries than COVID. And by basically we panic the entire population, and older people who probably should take more precautions, they probably underestimated their risk of mortality, whereas younger people vastly overestimated it. Both are bad. You shouldn't have young people locking themselves in, causing themselves psychological damage and living in fear when in fact the risk of mortality and risk of bad outcomes is so low. And for older people, we probably should take in more precautions. It's just an absolute failure in public health messaging.
Jay Bhattacharya, it's always so good to hear you and your common sense, and we thank the Prime Minister for timing his second vaccination jab during your interview there, Jay, which was perfect timing. Thanks so much for coming on, and hope we can talk to you again soon. Keep up the great work. Thank you, Jay Bhattacharya.
Always good to be on.
Thank you.